Kristen Connect, and I'm an orofacial myofunctional therapist. And today I'm going to review the lingual freedom protocol for infants. So, this protocol is an assessment protocol, which means this is what we use in order to find whether or not the baby has a tongue tie. We're assessing the freedom underneath their tongue, which is the attachment that everybody has to see whether or not it's too short or it's too close to the tip of the tongue or things like that. So, this one was created by Dr. Martinelli back in 2015, and anyone can have access to it. All you have to do is Google up the protocol, the Martinelli Lingual Freedom Protocol, and you'll find it. And you can print it off for yourself and you can mark it down. Let's go back up to the top here. So we want to know why we're looking for this. If the baby is kind of struggling with some normal, the normal things like sleeping and breastfeeding and things like that, then we want to be looking for this. If they're not struggling with anything and they're gaining weight just fine and mom's not having any pain, there's really no reason to be looking for this at that time. So we want to know just a little bit of history so that we can figure out whether or not we should do anything about this. So first here we got family history. From what we understand, tongue ties tend to be genetic. If either of the parents have a tongue tie, their children are more likely to also be tongue tied. And then if the baby has other health issues like colic, if they're not sleeping well, they're not gaining weight, things like that, those can be a sign that the baby has a tongue tie or a lip tie. Now, this assessment is just for the tongue tie, but we definitely want to be assessing for both tongue ties and lip ties. Now, the second section is all about breastfeeding. So, interval between feedings. Is the baby able to breastfeed about every 2 hours or maybe even wait a little bit longer? Great. If the baby is breastfeeding every hour, that's a sign that they're not getting enough while they're breastfeeding, and then they're wanting more sooner. Fatigue during breastfeeding. Are they getting really tired and kind of fussy, kind of struggling? They're not able to breastfeed for as long as they should, or maybe they're breastfeeding really, really long because they're just really struggling to get the nutrition that they need. Does the baby suck a little and then fall asleep? And are they doing that consistently? That's a sign that they're really struggling to breastfeed and they are tired because breastfeeding is hard work for a little baby. And it's that way for a reason. We want their jaw to develop, and breastfeeding is an excellent way to get a baby's jaw to start developing in the right way. Does the baby slip off the nipple and just kind of consistently slip off the nipple? Then that's a sign that the baby isn't able to latch very well. And so we definitely look lip tie, tongue tie, see if that's part of the problem. Is the baby chewing the nipple? This can be very painful for mom, and so it's definitely something we should be looking at because baby should not be chewing the nipple, but it's maybe something the baby is trying to do in order to get more milk. And if the baby can't, then it's going to start doing other things, such as chewing the nipple. And so breastfeeding, it shouldn't be very painful for mom, especially not painful for long periods of time. And so we should be definitely looking at the baby's mouth if mom is struggling to breastfeed. So down here we've got a few pictures of what to kind of look for. Oftentimes, if a baby has a tongue tie or a lip tie, that can mean that the tongue is being held down, and so that baby is going to be more prone to breathing through their mouth and have a difficult time keeping their mouth closed and breathing through their nose. If the tongue posture is somewhat elevated, but it's like consistently elevated all the way across here, or elevates really high while the baby is crying, that's great because that means they probably got quite a bit of mobility there. If, however, there's a dip in the tongue and just the sides of the tongue are elevated, but the center of the tongue is not able to elevate very much, that is a sign that the baby is possibly tongue-tied. If the shape of the tongue, when the tongue is raised, does it have this kind of nice curved arch tongue shape, or do we have a little V shape where the frenum is pulling really tight on the tip of that tongue, or maybe even a heart shape? Again, the tongue is being pulled down by that really short frenum. A few other pictures. So a healthcare professional or even a parent who is being gentle can raise the tongue. This is called the tongue lift maneuver. And what a person would do is put their fingers just inside and lift the tongue gently to see if there's a visible frenum here, a visible attachment. So this attachment right here looks a little bit like an Eiffel Tower, just like this one looks a little bit like an Eiffel Tower. And when the attachment looks like that, that is a sign that it has attached all the way to the alveolar crest, which is the jawbone, just inside the front of the jaw. And so ideally that frenum should be attached further back. And there's a really good picture right here. It says visible from the sublingual caruncles, which is a scientific term for the structures that surround the ducts, the salivary glands. And so a lot of our saliva comes through right there, and that lingual frenum should stop there. So if it continues past the sublingual caruncles right here where my arrow is pointing, and it continues down to the alveolar crest, that's a sign that the tongue tie has attached too far forward. And that's going to limit that baby's ability to move their tongue in order to get a good latch around the breast and be able to express the milk that they need. And so you can take a look at all these pictures. They're in the assessment and kind of try to judge for yourself what's going on and give your maybe a score here to figure out how likely it is that your child has a frenum that is too tight and might need to be released. And then there's some other things that you can look at, like non-nutritive sucking. So there's nutritive sucking, which is breastfeeding, and there's non-nutritive sucking, which is like sucking on a finger or on a toy. We want to go through this as well. So non-nutritive sucking, the little finger, you could put a little finger inside their mouth, and they should start to suck and have pretty good suction with their tongue, and even with their mouth open just a little bit. If you can get their lips to open while you keep your finger in their mouth, is their tongue holding that suction on your finger, or do they have to have their lips around your finger? So that's something to look at. Nutritive sucking during breastfeeding. Um, we just want to observe them. Ideally, the dentist or the pediatrician or the orofacial myofunctional therapist or the lactation specialist should be observing breastfeeding for 5 minutes. And what are we looking for? We're going to look for sucking rhythm. There should be a pretty good flow to this. So several suckings in a row be followed by these short kind of breathing pauses. But if there's only a few, like a couple to a few sucks in a row, followed by like long pauses where the baby's like really struggling to get some air or something like that, that's a sign that, again, the baby is struggling and might be due to a lip tie or tongue tie. These things can be due to other things, but this is what we're looking for here at this assessment. Coordination among sucking, swallowing, and breathing. We've got balance between feeding efficiency and sucking, swallowing, and breathing functions without stress. Now that's kind of vague, but in the next line we have what's stress. We've got cough or choking or dyspnea, which is labored breathing. So you can hear your baby like in between suckings. And it doesn't have to be quite that dramatic either, but that shouldn't be happening. Regurgitation, hiccups, big swallow gulping noises, clicking. All of these things are a sign that the tongue isn't able to latch very well. And so it's doing these compensation type maneuvers and movements, and it's creating all these noises, and the tongue isn't able to kind of gauge the milk flow. It's maybe being tied down so tightly that it's not able to swallow well, and so the baby is feeling this kind of choking sensation. There's a few different things that the tongue tie is causing, and so these sounds are what we want to be listening for while we're listening to a baby breastfeeding. Again, nipple chewing, that's shouldn't be happening. It is a sign that there is something going on, or clicking, as I already went over. So you could give your baby a little score and see, and then bring this to your dentist, your pediatrician, a dentist that is airway focused, a pediatrician that is aware of tongue ties, a lactation specialist that is also an orofacial myofunctional therapist, or an orofacial myofunctional therapist who also works with babies. Oftentimes, the person that you want to bring your baby to is someone who has more than just one type of training. It often, those of us who have training in the mouth as well as other types of training are the ones that are going to know a little bit more about this and are going to be looking outside the box at what could be causing these issues. So I hope that helps, and I hope that bringing this assessment, this documentation of what's going on with your child to your provider helps you find the answers that you need for your child. If you have any questions, please reach out. I'm happy to answer them.